So we wanted to look at the tail of the curve concept in patients who are treated with pemetrexed-based chemotherapy, and this concept has become more and more important, especially in the realm of immunotherapy, where we just saw about 25% long-term 5-year survivors in patients treated with pembrolizumab, which was Dr. Guerin's trial he updated for us today. So we looked to see if you could see that same tail of the curve up here in patients treated with chemotherapy, particularly pemetrexed. Anecdotally, we have patients in our practice that seem to have done very, very well, with sometimes even coming off chemotherapy and still being in remission. So our abstract looked at patients at our institution treated with platinum and pemetrexed. Some patients did get bevacizumab, but the main factor was the pemetrexed and the pemetrexed maintenance, and we presented our findings. We published our findings. Just to comment on the general population we included, the median progression-free survival mirrors what we see in pemetrexed-based trials, and that was a little bit over 6 months. However, we did see an impressive tail of the curve, with 14 and 11% of patients surviving 4 and 5 years out. Not all of these patients were still on chemotherapy or they had switched to another regimen, but we still did see a progression-free survival in the single digits, but still a progression-free survival out at 5 years, with patients not needing to move on to a second-line treatment.